Dr. Ola Brown, the founder of Flying Doctors Healthcare Investment Company. All right, thank you so much for joining us, Dr. Ola Brown. Now, I just want to start off with the challenges that Nigeria faces in terms of the healthcare sector. The country has the biggest GDP on the continent, but yet so little goes into healthcare expenditure. Why has Nigeria's healthcare sector been so poor, and what challenges do we need to sort out in order to turn that around?
Okay, first to give you some context, I'm a medical physician, I'm also an economist, and I specialize in infrastructure finance. So my first degree was in medicine and my second degree in finance and economics. So I will be moving in and out and weaving in and out between sort of three disciplines as I sort of go forward with this interview. So in terms of healthcare infrastructure, I don't think it's just a Nigerian problem. I actually think it's an African problem. Africa has overwhelmingly the worst healthcare outcomes in the world. So in terms of like the number of children that die in a year, or the proportion of children that die in a year, in terms of the HIV/AIDS burden, in terms of the number of mothers that die in the process of pregnancy and childbirth, across Africa, we have the worst outcomes. So I'm talking about worse than Iraq, worse than Syria, worse than Afghanistan, in many places in Africa. And that's all due, these millions of people that die, preventable deaths every year, is all due to underinvestment in healthcare infrastructure. And I think it was possible to ignore the importance of investing in healthcare infrastructure prior to the COVID-19 epidemic, or pandemic now. But I think that the pandemic, one thing that the pandemic has done for African leaders is bring healthcare into sharp focus, especially in the lockdowns, where a lot of sorts of politicians that perhaps would normally get their healthcare in Europe or America or Asia couldn't fly out. And we saw instances of politicians across Africa saying, I didn't know that the hospitals were this bad, and we desperately need to do something about it. So I think that, the COVID-19 pandemic has really brought this issue of Africa having the worst healthcare in the world, of any continent in the world, into sharp focus, and has highlighted the $66 billion gap in healthcare infrastructure on the continent.
So would you say that because of the problems that COVID-19 has accelerated, I mean, you talk about politicians now having nowhere to go for their healthcare needs, but in Africa. So are you saying that the political will now has been accelerated because of those challenges that the wealthy and the affluent have been exposed to?
Absolutely. I think that sometimes, and this goes for not just politicians, but any people, if a problem doesn't directly affect you, it might be difficult to think about it in a completely objective way. But I am now seeing increased political will across the continent, and we invest across the continent in healthcare infrastructure. So we're seeing it from west to east to Central Africa, a lot more focus on how to improve healthcare infrastructure. And not just infrastructure in hospitals, because when we speak about healthcare infrastructure, most people think it's just hospitals, but it's actually hospitals, it's primary healthcare centers, it's diagnostic centers, it's water and sanitation projects, because let's not forget that the top killer of children under the age of 5 years old in Africa, or one of the top killers, isn't something that needs to be treated in the hospital. It's actually basic diarrhea. Due to lack of access to water. So all of these projects now, I am definitely seeing, and we are definitely seeing in our firm, sort of an increased amount of political will due to the pandemic and the complexities with regard to mobility, with regard to logistics, and with regard to severe illness that the pandemic presented.
And I'm even hoping that even us as citizens in Africa will also bring into the fore the healthcare agenda when we are electing our presidents and our leaders, because often really the healthcare agenda is overlooked when we do vote for our leaders. So I just want to go into then the investment, boosting investment in the infrastructure, healthcare infrastructure space. What kind of tools do we need to use to boost investment in that space?
So there's two sides, and I'll speak about it in sort of what we need to boost investment in healthcare. I'll speak about it from the side of governments and public sector, and I'll also speak about it from the side of the private sector and what the private sector need to do. But before I go into that, I'd just like to pick up on your earlier point about the political space and the role of citizens. Where there is good healthcare, you see that healthcare is normally high on the agenda for citizens as well. So in America, one of the top 2 issues that Americans vote on is healthcare. And you can see that American citizens get very, very it really sort of is a divisive political issue. And we probably know more as Africans about Obamacare and Trump care and Medicare and Medicaid than we even know about our own healthcare systems, because Americans are very, very vocal about healthcare. And in the UK as well, the NHS is sort of an untouchable political force. I mean, it's part of, I grew up in Britain, and part of being British is, you know, loving the NHS and supporting the NHS. And it is a big sort of political, it would be impossible probably for a politician in Britain to survive if they made cuts to the NHS or introduced policies that reduced NHS access. So now what can we do in Africa to increase the amount of investment in healthcare? So from the private sector side, which is where I play, running a healthcare investment firm that offers growth capital for private sector firms as well as infrastructure finance. I think that from the growth capital perspective, I think one of the major factors that sort of affects private investment in healthcare, that's sort of venture capital and private equity type investments, is around access to capital. So around people being able to fundraise for their institutional funding, I mean, for relatively new asset classes like PE and VC in Africa. But on the infrastructure side, I think that one of the biggest barriers for private sector sort of players in the infrastructure space is actually skills and know-how. I think that corporate finance is very or relatively well known on the continent. So people do a lot of corporate finance type deal structures. Project finance, however, is a lot more complex. Project finance it also involves complex contracts. It involves a lot of specialist knowledge. And I think that, you know, there is a skills gap in Africa in terms of the skills needed to put together PPPs and project finance structures. There's also the issue of access to capital. These tend to be big deals. And in terms of the sponsors or the type of sponsors that institutional investors want to see at the head of these deals, sometimes that's lacking as well. But on the public sector side, I think that, you know, people always talk about bankable projects. And to make healthcare bankable in Africa, where most people can't pay, the government needs to be involved. And I think the government needs to make it a policy objective to support healthcare projects by offering the right kind of contracts, the right kind of assurances, the right kind of guarantees to make these projects bankable. And we've not, prior to COVID-19 at least, we didn't see that kind of intentionality from many African governments for a whole host of reasons, including the fact that a lot of them didn't know that healthcare was this bad. Healthcare infrastructure was as poor as it is until they actually were in a position or in positions where they had to use the hospitals themselves or use the healthcare facilities themselves, and then sort of got that consciousness that this is an area that needs huge improvements. Like I said, it's a $66 billion gap. And then also, I think the politicians were more focused on hard infrastructure. So the typical African politician, I don't know how it is in South Africa, but definitely in Nigeria, from a public sector perspective, they want to show things that they've done that look solid: airports, roads, bridges, and healthcare, power stations, right? And healthcare infrastructure was kind of neglected in favor of things that they thought could bring about economic growth, like airports. The link between building a new airport and bringing economic growth is very clear. It's very well researched that if you improve road infrastructure, then it enhances trade, and that brings about economic growth. However, I think that we neglected to sort of, and maybe this is the fault of the medical community, maybe this is the fault of infrastructure, investment professionals that focus on healthcare like myself, but we haven't really advocated and communicated the link between healthcare and economic growth. There's actually data that shows that investment in healthcare and wellness on the continent can create 16 million jobs. Wow. And a recent paper from the IMF shows how investments in healthcare and sanitation in emerging and poorer countries actually have a huge jobs multiplier and a huge effect on the economy. And perhaps we had not communicated that. And also in the public sector didn't have that depth of understanding to see the link between investment in healthcare and jobs and growth. Particularly in South Africa and in Nigeria, I know we have this in common: high rates of unemployment, a lot of young people that are unemployed or underemployed. And investments in healthcare aren't only great for health, but they're also great for jobs and great for the economy. And I think that that's something that we have just begun to come to sort of the realization of, whereas before our infrastructure efforts concentrated on roads, bridges, and power stations.
Yeah, and I'm just interested actually in the success factors that we do need to build a fruitful and bankable projects in healthcare infrastructure.
Absolutely. So healthcare isn't free. Somebody has to pay for it. And usually citizens can't afford to pay for it. So I'll give you an example of the UK NHS, because that's a system I'm familiar in and I've worked in. The UK NHS system costs the British government about $200 billion. Sure. $200 billion would pay Nigeria's federal only healthcare budget for 200 years. So not only is it sort of something that citizens usually can't pay for, but it is a big expense. And you see developed countries spending between 7 to even up to 15% of GDP on healthcare. So unless governments are making it a priority and are providing the structures in terms of sort of guarantees and contracts and reassurances to make sure that investors can get their money back, there will continue to be underinvestment in healthcare. And the NHS in the UK, Turkey, for instance, has had a very, very successful project, public-private partnership structures, which we can just copy. Honestly, the PFI system of bringing investment into healthcare in the UK was extremely successful and brought huge amounts of public sector finance into healthcare infrastructure. And these are, case studies that aren't hiding. They're things and programs that African policymakers can copy and learn from and adapt to our environment to bring in that much needed private sector capital into healthcare. We know that fiscally, our governments are squeezed. Again, I don't know the figures for South Africa, but definitely in Nigeria right now, we're spending almost 70% of our budget on debt servicing. Our debt to revenue ratios, or our debt servicing to revenue ratios are some of the worst in the world. So we know that our governments don't have the fiscal space to make all the investments that they need to make in healthcare, in education, in defense, in aviation infrastructure, in road infrastructure. I mean, it's too much for governments that already, have little fiscal space to do all of these projects. So the need for private financing, the need for institutional private financing is greater than ever before, because we know that our governments can't do it all by themselves. And that's why putting in place these sorts of guarantees, these kind of working with the governments to put in place structures that allow for certain levels of income for the private sector to be assured, bearing in mind that citizens can't pay for this service, it is really, really important for making these projects bankable. Of course, there are private sector revenues that can come into healthcare in all sorts of different ways. And insurance schemes that can be put in place, government-backed insurance schemes that can be put in place, specific taxes that can be put in place for revenue assurance. But these structures really need to be built in collaboration with the public sector.
Indeed, collaboration, and that is exactly what we need for the success of the healthcare infrastructure space in Africa. Thank you so much for your time, Dr. Ola Brown, the founder of the Flying Doctors Healthcare Investment Company.